Hi, this is Lauren Calger, and this is my presentation for my research study on how nurses' exchange report improves patient safety. Patient report or a handoff communication is the exchange of pertinent medical patient information and occurs throughout all phases of the patient care. The Joint Commission estimates that 80% of medical errors are due to inconsistent communication and the failure to report pertinent patient information during the handoff procedure. Pertinent patient information can be lost during the transfer of patient from one provider to another. Information loss can lead to an increase in medication error, sentinel events, and poor patient outcomes. There is no consistent established report communication that is practiced. Nurses from studies develop their own, and facilities develop their own. So unfortunately, when patients are transferred from one unit, even may have their own. So when patients are transferred from one facility or unit to another, there may be information lost in the transfer. A successful handoff is a transfer and acceptance of the responsibility for patient care achieved through effective communication. Evidence points to the fact that communication errors are one of the most frequent contributing factors in root cause analysis of adverse events. In my study, I chose to have my PICO question be where I look to see if one way of exchanging report, whether it's tape, paper, face-to-face, at a nursing station, behind closed doors, if one way gives better results as far as the exchange of patient information. Literature reports a lack of adequate communication skills are used in nurse-to-nurse reports. One of the problems is, like I said, there is no established standard report exchange. People develop their own, units develop their own. A variety of problems during report, such as incomplete and inaccurate information, few chances to ask questions because the nurse going off is in a hurry to leave, repeated interruptions, it's occurring at the nurse station, phones are ringing, other care providers are there talking, family members, visitors, and insufficient time can lead to omissions and misunderstandings. In Lit Review, I found several studies that evaluated nurse-to-nurse or care provider-to-care provider handoffs. In the home one, it was actually a Lit Review study that looked at the effect of a standardized handoff in patient care. And one of the things that they recognized with it was that there are barriers to an effective handoff, such as there is no standardization, communication, time, environment, lack of training. Nurses are not given a course or training in what is a good handoff, and the environment can have influences. In another one, Triplet looked at a critical care unit, and they looked at using a worksheet bedside report, and they actually did a review before the report was implemented and after, and compared the differences. And there definitely was an improvement in the staff confidence. And what this is pertaining to is the fact that people don't always have confidence in what the staff member is giving them in report, on whether it's true or false or accurate. So this study actually looked at that and ways to improve confidence levels between care providers in reports. In the Robbins one, they looked at implementing a checklist and how that actually improved handoff. And they did show that the checklist did improve relaying the patient information. But that comes down to having a standardized checklist that everybody's familiar with. And when you're giving, you go through the flow. And so people are used to that. And people develop a routine of going from one step to the next. In the Maxon study, they looked at the effects of a bedside communication and on patient and staff satisfaction. And they actually reported that there was an increase in patient and staff satisfaction and also a decrease in medication errors when the reports were given at the bedside. In the CARE study, it was noted that a single person coordinating the handoff in one distinct method, which would be a checklist or something that both providers are have knowledge of and understanding of, improved patient handoff. In Shalini, they did a pre and post study on the evaluation of SBAR, and they found that post implementation of SBAR actually cut down on the number of errors during a handoff. In my study, I would choose a med-surg unit with direct patient admits from an operating unit. Each participant would receive a detailed report to read about the fresh surgery patient, and a third of those nurses would only receive the detailed report. The rest of the nurses would watch a video handoff report where there was a taped report, a bedside report, and a report exchanged at a nursing station. After the video, participants would be given a checklist to evaluate the degree of patient information and status exchanged during the report. So the nurses watching the report are assuming the position of the nurse who would be getting the handoff from the nurse who is in the video. And each survey would be evaluated for accuracy on a score of 0 with no remembering of details to 6 points. Nursing handoffs are a critical tool during the patient's pathway from one caregiver to another. Handovers are implicated in the safety and clinical risk management of patient care. Breakdowns in verbal communication account for 85% of adverse effects. In the results, handoffs were found to be effective when information was provided in the same order, were verbal, were face-to-face with limited distractions and interruptions, and provided a summary, plan, and goals. A consistent approach to patient care handoffs is an important aspect of best patient care. So in practice, we need to develop a checklist. It needs to be practiced with every handoff. The handoffs need to be face-to-face and verbal, and they need to be in an area away from the nursing station, whether it's at the patient bedside, just to decrease the amount of distractions. And that's my report. Thank you.